I read recently that the Ministry of Health decided to put doctors at the different medical facilities across the island. What can you tell us about that as it is right now?
All right. So, as part of a larger plan, it's actually not even a new plan. It was the rekindling of ideas. You find sometimes, you're there, you have problems, and you would look and see what are some things that persons would have thought of in the past, even if they didn't get it implemented, that could assist the system. And then if it wasn't implemented, you try to find out what was the stumbling block, and then you see if it makes sense and see if it's still applicable. So something that we chose to reconfigure was to look at the entire health system. And one of the problems that people were having was with JNF, it being the main, call it hospital in St. Kitts, a lot of traffic was passing through there. And it was causing a bit of a problem with regards to wait time, which is something that's a universal problem. But in a small place like St. Kitts, you still have to try to see how you could reduce that. Now, we looked at it to say we have two other hospitals, two other facilities that have the ability to see patients in an acute setting. That's Pogson in Sandy Point and Mary Childs in Molyneux. But the issue was that over the years, they never had permanent medical staff. They usually would be staffed with nursing staff, and doctors would be on call. But those doctors that are on call would be doctors that actually serve in the health centers that would double and also cover the hospital. Now, I was one of those doctors, I can tell you, even though it's doable, it's difficult.
Okay.
And you can still deliver quality healthcare in that setting, but it's a lot more challenging. And the simple fix to that would be for it to have dedicated medical staff in those, well, we refer to them as outposts, but they are hospitals in their own right.